Hello, everyone. How are you
Hi,
all? Hope you are doing well.
hi, Dr. Nabila. I guess we can wait for like 5 minutes so that all the students can join in and then we can start. What do you say?
Yeah, yeah, sure. That's pretty fine.
Thank you. Dr. Nabila, we can start now. Thank you.
Hello, everyone. Can you hear me? Please clear me first.
Yes, Dr. Nabila, we can hear you.
Okay, so we are starting the session today. It is more like interactive session because I want you guys to just ask whatever the query you have regarding the AMC, the course details, and everything, right? So first, we need to know about the what's AMC, what type of exam it is, how many exam you have to give, and what sort of questions they will ask, what important topics they have, and how much you have to score to pass the exam. So basically, AMC is an more important. Like it's an AI exam, right? It's an AI exam, so you have to give the answer, and according to your answer, the next question will be asked. You have multiple choice of 150 questions from which they will give you the score. It is like more like a scoring system. Like you have to score from 500 to pass the exam to 250. Even the people can fail to 249 as well. So you have to study hard more and more. Another thing about is that from the first question, you will see that if you get the very difficult question, it means you just did the right answer. But if you get a very easy question, that means that you have even wrong the question, because AI will give you the questions according to its difficulty. The more the question is difficult, the more you will get the marks. The distribution of the marks are very undistributed. Like it's not like one question have 2 marks, another question have 2 marks. No, even the difficult one has more marks, and the less difficult one has less marks. Because in exam you will see that people who even some will pass on the 90 questions as well, some will pass on the 80 question as well. It depends on the how difficult question they have done. Okay, so the amazing thing about AMC is now it is clear or not?
Yes, Dr. Nabila, the voice is clear.
Okay. So the big thing is about that there's no pilot question at all. So there's no reduction of mark, no negative marking. You guys have mastery questions. Mastery questions are like that. That will be the key questions. Like they will give you from the emergency settings, more questions from the emergency settings. For example, a person came with a spider bite, a person came with a snake bite, or a person came to you. You have to done CPR with them. So what's the steps of the CPR? So these are the mastery questions. Okay, that will be the passing standard scaling system. As I told you that you don't have the equal distribution of marks. You have a scaling system that you have to be pass for 250 questions. The question number will be 150, but you have to score according to the scaling system. 250 will be the fine line. Computer adaptive exam, that will be the AI exam. So kind of very difficult from other exam. That will distinguish it from the USMLE and PLAB. Like PLAB, you can give on the paper pencil on computer as well. USMLE, you can give the computer, but USMLE have a definite pattern. Like they have set the questions for you. But for AMC, what you have to do, you have to have. Hello, can you hear me?
Yes, Dr. Nabila, we can hear you.
Okay. So for a computer adaptive exam, what you have to do, you will get your questions according what you answers. For example, if you get the question from breast surgery, like what will be the most common fibroadenoma in the age of the girls, like from 25 to 30, from 70 to 80. Among the next question, that will be more difficult. Like they will ask you the invasive procedure, how you will remove it. They will ask you the investigations. So this is the AI exam that the more difficult questions you will get, the more chances you will pass the exam. The less difficult questions you will get, the less chances you will pass the exam. But again, the more important thing is how you take the subjects. Because in AMC, like other PLAB and USMLE, it's not like just medicine, surgery. It's more like in AMC, psychiatry is very important because most of the students don't know about the ethical questions, don't know anything about the mental health questions. even don't know about the other question as well, that will be from the community medicines. Another thing from that is most of the people ask about examination centers. So these are the examination centers that will be situated in the Australia: Adelaide, Brisbane, Canberra, Hobart, Melbourne, Perth, and Sydney. And the states are given. These are the centers that will be the outside the Australia. These will be the given states, cities, and countries as well. The big thing is that Malaysia recently opened the center, and soon will be most of the Pakistani students will ask that they will just right now just updated the dates, because in the previously they said that they will open in the Feb 2024. Now it's like move in the 2025 Feb. Hope we get the center in Pakistan as well. But there was a big news that Malaysian people get the center in Malaysia. Okay, so most of the people will ask me about how we can prepare it, how much time we get it for the preparation, and how the self study we will do, what we have to revise, because most of the people will choose their line of the, what we can say, field. Like some people will go for the gynae, some people go for the peds, and they have the difficulty that they forget everything like from the medicine and surgery. So that's why the taking of the course is very important. Yes, doctor. The center is recently open and they are expected to open in more countries as well. Okay, for the time of preparation, you have to be the 4 to 5 months of preparation who is starting from the scratch. Is there anything wrong going on between? Someone please update me.
Just that there are some echoes.
Dr. Nabila, your voice is clear now. Like there is no echo now.
Okay.
It's better off now.
Please, whoever write in the chat, please make sure we all are the colleagues.
Hello. Hello.
Hello, hi, Dr. Abdul.
Yeah, I don't know. Somebody is
Yes,
using
yes.
my profile to text some. I mean, messages. I
Yes,
don't know who is-
I was very much shocked that something is happening. Someone trying to hack this, someone trying to stop my screen. I don't know what's going on.
I did not text that. I'm really, really sorry. I didn't know that. I mean, I'm not so like disrespectful. I'm not trying to do that. Like, it was not me. I just wanted to clear out that, and I'm really
Yeah,
sorry
yeah,
about.
no worry. Actually, that was Sri Ram. Maybe we have removed the person from the meeting, so we can continue. Thank you so
Yeah, I mean,
much.
it came up to my name, so that's why I'm
Okay.
clearing out.
Don't
Thank you. Okay.
okay. Worry about it. Someone try to putting something like virus or something, because someone trying to stop my video and it's been 3 times. That's super fine. Okay, so we are moving over the time of preparation. So 4 months of preparation is pretty well. That is required for everyone. A study partner. The most important thing is that you cannot even do recalls solely, different things solely. So for this thing, you have to need any type of academy. As I told you that Whoever is trying to do this, my request is please, doctor, don't do that. Don't try to mute my mic. Don't try to shut off my screen. That's a very humble request. We are just here for your guidance. We just want you to get a good future. Please don't do that. It's not worth anymore. Okay, for the questions, dear doctor, you ask about the banks. Yes, every bank is very helpful. Whatever the online subscription you get, either AMEDX, either MPEXX, you will get a very benefit. But the thing is that AMEDX have a very fine and a very big explanation that will help you a lot to make your own notes. But it take a long pretty time. That's why we more focus you on the taking the courses, taking the classes, because these are more concise for you. These are only that subjects that will come in the exams, or that will be coming from the 2012 of the exam. So we have lots of past papers, we have lots of theory regarding it, we have lots of new recent guidelines according to it. The major problem you guys face is about the guidelines, because guidelines are changing every day. Every other day they are changing the guideline, and most of the people are very much in difficulty that how you can follow the guideline. Okay, so you have a very good question, doctor. How our courses differ from others is that we have a very detailed explanation of everything, and we are even giving a right guideline and a very recent guideline as well. And the doctors we have hired, the mentors we have hired, we have a mentors from every faculty, or we can say that from every specialty. For example, I am a resident psychiatrist, someone is a resident of emergency medicine, someone is a resident of internal medicine, someone is a resident of op kinds and surgery. So we all mentors are the from resident or either consultant from each specialty. So what we are doing, we are putting the recent guideline from RSHGP, so you don't find a difficulty in finding any questions. And we are putting every effort and putting lots of PCQs, because this exam is constructed of the PCQs. So we are putting our efforts so you can pass and have clear concept. So that will be more helpful for your AMC clinical exam as well. So this is the point that our courses differ from other courses. You have take lots of courses, but you see they will just putting the very small detail about it. Yes, we have a very good session of recall. We will even give the very good and pretty fine recall sessions on the date of the exams. And we have a both. We have a recall session separate course as well, and we have a recall course along with the regular course as well. Okay, so it is like more like how to pass the exam in first go. The number one and the basic key is consistency. Okay, relax, guys. Don't get worried about someone is unmuting your mics. Someone is trying to open your video. Please don't be panicked. Someone is trying to hacking it, but just be consistent with your goal. Whatever goal is, whatever the question in your mind regarding the AMC, the BCQs, the cases, you just ask about it. Let the person who is destroying it do it. That's a very not a good thing. Okay, guys, relax about it. I'm very sorry who is doing this. I also don't know about it. Just try to ask your concerns about AMC. Yes, we have lots of mock tests, like not even the mock test, like we have each separated sections, like from gynae, surgery, medicine, and from each topic we have lots of PCQs along with that. And we have a pool of PCQs as well, and we will take the mock at the end of the exam as well. Okay, for okay, this is not I'm typing. I am just well, I'm you can guys ask any question. I'm not typing anything. Someone try to type from my side and sending the lame messages. I don't know why. I'm just talking, and don't even go for the messages. If I want to say anything, I will say in the mic. Okay. Yes, dear doctor, you are asking about the psychiatry. For psychiatry, we have launched the workshop as well. And this workshop is very pretty easy for every guys. Like if someone don't want to take the whole recall course, or someone don't want to take the regular course, he or she can take the psychiatry course only. In the psychiatry course, you will find lots of BCQs. It's like more than 500 BCQs from each topic, like from child psychiatry, from substance abuses, from every type of topic. And another thing is about that, from the topic as well, we have also the recall things of psychiatry as well. We have live sessions for psychiatry as well. So you can get lots of material who don't want to buy the recall course or the whole regular course. Regarding the mock exam, yes, we give you the lots of recalls from the 2019 up till 2024, and from this you will get like 20 to 30 questions from your exam. But for this, you have to do consistently the follow the regular courses, the classes, and everything. Yes, we do recall exam course as well. We will do 5 days of recall exam course as well. For the November students, we will do it. Don't worry about it. We will provide you the recalls as well, with a proper explanation, with the proper guidelines as well. Mock test is basically, it's not for your the question will come in the exam. That is the mock test. Mock test is basically to run up your speed.
Hi, so basically we have created this mock exams so that you can have a real exam like experience. In the mock exams, you will find real-time like papers that will contain 150 questions that you can attempt
The base
on the website to have a clear view. And also you can have multiple attempts as well.
the basic thing we are providing mock tests and everything is just because the time limit, because most of the people will complain in the exam that we have a very less number of time, like we cannot even complete our questions. We will just are running out of time. We just did 130 question and the time was over. We cannot even do more questions. So the purpose of mock is that you have a speed up the according to the time, you get the questions according to the time. So in the real exam, when you will sit in the real exam, you did not feel like a zombie that these are coming for the first time or we are sitting in the first time. Yes, doctor, they will give you a very, very good discount on the courses. You can ask about it to the management as well. They will give you a very good discount. Like we have providing the course in the market, no one is providing like that. Yes, we will provide the recording of this session as well. Okay, regarding the John Murtagh and Red Book, someone who is starting from the scratch, you have to do John Murtagh for the reference book, right? You have to put this book for the reference, and Red Book is very important. Like Red Book, everything from the guideline regarding the diabetes, regarding the different type of cultures, regarding the osteoporosis, regarding the elderly abuse, every guideline is written in the Red Book. So Red Book is a very key. AMC MCQ book is very important to solve it, and the other banks in the course. These are the key to move with the MCQs. Regarding the prices of the courses, regarding the schedule of the courses, you will can contact Asma, you can contact the MedExpert team. They will are very nice. They will provide you with so much discount courses. Even they will provide you everything and every detail about it. Kaplan psychiatry is very good. If you are doing Kaplan psychiatry, it is very good, but it have a less number of topics. Like in the exam, they will not ask you about the neurotransmitters mechanism of action. So it is like more or like likely you have to do the clinical side more. Kaplan psychiatry is a good book, but it is not if fair enough to pass the exam. You have to do more psychiatry from that. No, doctor, no one can even study the whole guideline. That's why we ask you to just take the course, because we know how to make you prepare for the course, right? So we have a lots of material for it. We prepare material for you guys, and we will put the relevant and the more important RSGP guidelines for you guys. So you don't have the difficulty in exam regarding the basic guideline. For example, still people are practicing that a paper bag mask is used for the anxiety and people came to you. But in the recent guideline, it's obsoleted. We will provide the oxygen to a person. This will question come in the exam frequently. They will give the ECG and they will ask the treatment of that a patient came with a panic attack and what you will do. So they will putting that the thing again and again that you will provide the paper mask bag or something like that, but it's obsoleted. Now you can give the oxygen to the patient who is coming to the emergency department. Yes, we are also giving it's same like that. We are giving the free webinars. We are also giving the free webinars of the questions. We have topic like from emergency medicine, from psychiatric workshop. You can see on the pages. We provide you the questions. We provide you the files as well for as a trial purposes. You can see it, and we have lots of material for the students who can join us. Dear doctor, the cost of the courses will I'll be see in the end of the session as well. You can subscribe from the asking to the management. You just message on the WhatsApp group of MedExpert. You can email to the MedExpert email address. You can also message on the Facebook group of MedExpert. These are the accesses that can provide. Also, the MedExpert team can provide their number in the chat as well. So you can just confirm them, and then you can got the course. Dear doctor, it's already mentioned on the AMC page, basic page. That will be the $2,999 across 3,000 AUD. So you can get the schedule from there. You can get the fee structure from there because it's kind of rapidly changing from there. So it's better to just search on the AMC website and you will get the cost of the AMC or AMC exam and the center. Everything is written on there.
So the latest exam fee is $2,920 Australian dollars.
So these are some preparation books. This will be the handbook. This will be the medical legal handbook, John Murtagh, Anthology of Medical Conditions, Oxford of the Clinical Medicine as well. These are some more book. RSCH periodic handbook is basically the guideline for the peds. These are for the emergency textbook and the textbook for surgery who just want more description. You can use these books as well for the resources and for the references. Okay, as I told you that guidelines is very important. For the guideline, we follow the RSCGP. Yes, we have like all the material in the app. We will provide you with every type of BCQs. We will provide you the PDF of every type of book, whatever you want. Just don't worry about this. When you just subscribe our course, either it's from Recall, either it's from whole course, we have this PDF. So you don't have to worry about it. Okay, from the guidelines, we just put the guideline according to our slides. Like whatever the topic we told you, we will put the recent guideline according to it. For example, if we are telling you any topic from emergency medicine, we will just provide you the guideline as well. And our slide is from the recent guidelines as well. Okay, so most of the people are asking about the courses. What are the courses and how we run about it and how much sessions we have. So this is the detail about the courses and from where we are starting and the duration of regular courses. Everything is written about it.
So basically, in our regular course, we're going to start from 11th of October and its duration will be for 4 months. And in the regular course, what you will be getting is first the orientation session, like how to use our course, how you can get benefit from it. Apart from the orientation session, we are going to provide you the 42 live sessions in which we are going to teach you all the important topics in the live session with the expert mentors like Dr. Nabira, Dr. Samaya, Dr. Fahad Joya, and Dr. Chinmay Trivedi, who are going to conduct these live sessions for all of you to guide you properly. And these sessions will be with the latest Australian guidelines. So you don't need to even open the book or you don't need to read the guidelines, because we are going to provide you everything in the live sessions. So if you attend the live sessions, all your topics will be well prepared. So now, apart from the live sessions, we are going to provide you the question bank that will contain 5,000 plus questions along with correct answers and explanation. So if you want to practice the questions, you can use the question bank on the website. And then apart from the question bank, we're going to provide you the mini mocks or the quizzes just to help you boost up for your confidence and to practice as much as topics as you can. And then we will be having a special psychiatry workshop by Dr. Nabira. And in the psychiatry workshop, we will be having live sessions for psychiatry. We will be having proper question practicing for psychiatry so that you can know how psychiatry questions will come in the paper. And yes, the recording for every live session will be provided to you. So once there will be a live session on the very next day, we're going to upload the recording on the website so that you can watch the session later as well. Okay. And the access will be till 4 months so that you can have enough time for your best preparation. So now let's see at the schedule. So now we have divided every day in 4 months so that you know what you need to do on daily basis. So let's suppose on 11th of October, we have given you notes and flashcards that are available on the website. So when you will open the course for AMC Regular Course, you will see the module of notes and flashcards in which you will find all the topic notes and you will find all the flashcards that you can read for the theory purposes, in which we have mentioned all the important points. And then on 12th, that like we have orientation session in which we are guiding you how to use the course. And then on the next day, we're going to give you the notes and the flashcards just to read the topic, so that when there will be a live session on October 18th, so you will be well prepared and you can directly interact with the mentor as well. And then once any module is over, we are going to give you the mini mock that you can attempt on the website so that you can check whether you are well prepared for that topic or not. And also, every topic you can attempt multiple times as well. And then we will be having a group discussion in the study group. So once you enroll in the course, we are going to add you in the study group in which you can conduct discussions with the mentor just to practice as much as questions. And then after the psychiatry workshop, we will be having medicine module in which we are going to conduct sessions for medicine. Like we will be having separate sessions for cardiology. We will be having separate sessions for rheumatology, renal, GIT, like all the important topics will be covered in these modules. And then after medicine module will be over, then we're going to provide you with the mini mocks. And then we will be having a group discussion with our moderator, Dr. Aisha, just to make sure your medicine module is well prepared. So Dr. Nabila, can you please move the slide? Thank you so much. So basically, after the medicine module, we have surgery module. And then in the surgery, again, we are going to conduct live sessions. Like suppose every module will be covered from psychiatry till miscellaneous topic, from infectious diseases. Like you can just name the topic and we are going to conduct the live session for that, so that every topic that is important for your AMC exam will be covered in this regular course. And by the end of the course, we are going to provide 4 mock exams that will be actually like the real exam, that will contain recall questions, that will contain all the important scenarios, all the important high yield questions, so that you can practice as much as questions before your exam day. Okay. Yes, it is important, but if you, for like suppose if you don't follow the notes and the flashcards, so it's totally okay, because we are going to cover all these important points in the live session. We're just emphasizing on go through the notes and the flashcards just so that you can directly interact with the mentor in the live session. Okay, so just to make you understand the topic in a better way, that's why we have given these notes and the flashcards, so that you can just revise the main important things. And also they will be very important just before your exam day, so that you can just revise the important points, because it's very stressful in the last days. So in order to go through all the things, you can just go through the notes and the flashcards and just read the important points. Yes, you can skip the books if you follow the notes and flashcards. If you follow the live session, then you can skip all the books. But for the safer side, we have provided you all the books in the course. We have provided you all the guidelines in the course, so that if anybody needs to read any topic and if anybody finds any problem in any topic, we are going to provide you the books and the notes so that you can just read it out and directly ask the mentor if you're facing any problem. And all the mentors are always available in the study group, so if you want to ask anything, they are always available. Apart from these things, we do provide the recalls as well. We have recalls from every month, from February to October, every month, 5 days. So once you join the regular course, we are going to provide you the recalls as well. So you don't need to go anywhere else. You don't need any other subscription apart from our course. Okay. We are going to provide you everything like question bank, recalls, you name it, and we provide it. So we are going to provide you everything. So Dr. Nabila, would you like to add anything over here?
Yes, I want to tell you that most of the people will ask me this question again and again, that what's the difference from your academy to other academy. The big thing is that I am even 24/7 available on the text as well. Whatever you can message, I can even clear the doubt. Even if the explanation is written over in the slides, I can even reply you with everything, right? Yes, Dr. Abro also is the mentor, and Dr. Abro can provide the detailed explanation regarding the course, regarding the things, whatever you ask from her. And another thing is that if flashcards, we have lots of BCQs. Another thing, we have separate BCQs of each chapter. For example, if you did the cardiology, we have cardiology's question, lots of cardiology questions. If you do the surgeries topic of GIT, we have lots of topic from surgery as well. Yes, you can see in the last of our message, we have lots of people over in September session who passed the exam, and you can ask them that we don't have a little slides of 50 or 100 slides. We just have 600 slides of each topic, like 600, 500, from where we did the every detail about the topic. Either it's from peds, either it's from any gynae. We have lots and lots of things. We have questions, we have guideline, we put the red book and explanation of live session as well. You don't need to worry if you mark or if you take our course from the regular course. You don't need to worry about the schedule, how to make it. We made your schedule. We will tell you from where you to start, from where to end, from where to push up your whole preparation. Just don't worry about it. Also, this is the big thing. I just did a separate psychiatric course. Like if anyone don't want to buy the whole course or regular course or recall course, just buy this psychiatry workshop. We have lots of material for psychiatry. We have each topic. Along with that, we have PCQs of each topic. Along with that, we have mock of psychiatric workshop, and we have live session for workshop. If someone don't get anything, you can even ask me personally. I will even available for you guys, can explain again and again. Even we have psychiatric recalls as well.
Dr. Raz, if you want to ask what is the difference between our academy and the other academies, is that you can just watch their live sessions. Okay, you can just have an idea what kind of sessions they are doing. Is it helpful for you or not? This is the first thing that you can do. And the second thing is that whether they are providing you everything to pass the exam or not. Like, for example, if you just want to take the regular course, they are going to charge you separately for the recalls, they're going to charge you separately for the question bank. But what we are doing is we are making the course affordable for everyone who wants to prepare for the AMC exam. So we are going to be providing you everything that you need to pass this exam. So in order to pass the exams, what are the main things? The first thing is the basic knowledge and the clinical knowledge that we are working on with the live sessions. The second thing is the practicing of the questions. So to practice maximum questions, what we are doing is we are going to provide you 6,000 plus questions in total. That contains quizzes, that contains topic-wise questions, like 6,000 plus questions with correct answers and explanations, so that you can practice as much questions as you can before the exam day. And the third thing that is very, very important for the AMC exam are the recalls. So we are providing you authentic recalls with correct answers. And if you need any explanation with every question, then we are going to be adding you in the study group. You can ask in the study group, or mentors are always available to solve all your queries. You can check the feedbacks as well. These are some of the amazing feedbacks from our beloved students who have joined us for the live sessions. And these are the feedbacks from those students who have taken our course and passed this exam. So our main goal is that if you are joining us for any course, our main goal is that you pass the exam. So this is our main priority. So you can see a lot of students are passing on every month. So you can check our reviews on our page as well. You can watch our website. You can check the courses that we are offering. We are not offering one or two courses. We have customized plans for you. Just talk to us. Whatever you need, we are going to provide that. Yes, Dr. Mihir, we have mentors on calls. Why? Because we are going to add you in the WhatsApp study group. So once you enroll in the course, if you have any difficulty, you can post in the group, you can tag the mentor, and the mentor is going to guide you and, tell you about all your queries. And we do arrange
Anything
extra
you want
sessions.
to
Let's
ask?
suppose if you have any query, if you want to talk to the mentor, we can arrange extra sessions for you as well. So our main priority is basically your preparation. Always welcome,
Also,
Dr.
one thing
Mihir.
is about our slides are from all our slides are from John Murtagh. All our slides are from recent guidelines. All our slides are from the basic things. For example, for psychiatry, we follow the because in you see in the John Murtagh you have very less material regarding the psychiatry. So we'll made it from the Oxford. That will be the textbook for the psychiatry. Similarly, from the surgery, from gynae, there's lots in the new edition of John Murtagh. You will find the obs gynae is very less, but we will take it from the agenda from other textbooks of the surgeries to make you sure that your whole syllabus will be covered. So if you do the slides, if you do the mock test, if you do the recalls, if you take the live session, because the thing about the live session is you can even ask anything from the mentor at that time, whatever the point you don't have clear. We have all the recordings because most of the doctors are working, and while working, you don't get the chance to get the live session. So we have lots of recording for it, and even if the you have see the recording after some time, you can even ask after some time as well. Yes, Chokra, you can ask.
Just to answer Dr. Rabab, yes, we do provide guidelines as well. Like we have provided red book and white book in the course. And also if we have a separate session as well, like how you can use the red book to read the guidelines. So we are going to guide you.
Even we will because most of the people don't know about the red book how to read it. They will just said that what we read in the red book, so we have a separate session for it in which we tell you how to read the red book and how the question will come from the red book. Okay, regarding the distribution of the questions, doctor, medicine have the most of the part, like 50% questions from the medicine, 40% from the surgery, 20 to 20%, 20 from each topic, like from the from psychiatry, from mental health, from community medicine, from peds, and from gynae. But the thing is that they consider you more like you know about the mental health, the more common things, whatever going in the Australia, like know about the Torres Island, the Aboriginal peoples. They want to familiar you with the environment. So they will ask you this more question because everyone knows the medicine and surgery, but no one knows about the mental health, the community medicine, right? Yes, doctor, you can pay in this installment as well. Asma and the Med Expert team are very kind to you guys and they will give you lots of favors for this. You can ask them as well. Yes, Dr. Kashi, we can ask. Yes, not every question has the same marks. Every question have a different marks. It depends on the difficulty. The more difficult question, the more marks you will get.
Dr. Ras, to answer your
I
question,
try to
we
answer
have,
everyone's question. You
yeah,
can please repeat your question.
yeah. So her question was that do we provide the important questions in the question bank? So yes, we do provide. Like we provide important recalls. We do provide important scenarios from MEDEX, from M+X. Like we provide all the important scenarios in our question bank, so you don't need any other subscription apart from our course. So yeah, it will contain all the important scenarios. So about the access, the course access will be for 4 months. It is basically for those people who are appearing for the February exam, okay? But if you say so that my exam is in March and before taking the subscription, you let us know that when you want access to be, then you can talk to us and we can, make customized course for you and we can, extend your access till your exam day so that you have enough time for your best preparation.
Yes, doctor, you can start your preparation from fourth year, but the difficulty is that lots of questions from the final year because it's contained the all final year subject like medicine, surgery. But what you can do, you can even take the course, you can even familiar with the subject that will help you to pass your med school exams as well. So it's a great time to start. Very good approach. Appreciate it. Any other question? Yes, we will tell you whoever that take the course, the mentor will guide you how to use the course, how they will give you the access, how they will give you the passwords and the ID links, everything they will provide you. Yes, Dr. Ikra, can you please repeat your question? Okay, whoever is starting from the scratch, you will need the 4 months to prepare for it. And if you are already done the course, you have to do the recall session as well. And if you done the recall, at least do the exam course as well. So it's either depend on from where you are starting. Either you are starting from the scratch, either you are starting from the middle. Dr. Ikra, it's the interactive session. It's all about the AMC. It's not about any type of course session or any type of subject session. It's all about the people want to know what's the AMC course is it, what's the AMC questions is it. It's all about it. Okay, Dr. Kashif, from previous year, like 2 to 3 year back, they want just for the, if you are asking for the Pakistan or Asian countries, they need you the PMDC number or something. But now you can even do apply it before doing the house job as well.
So, doctor, about the exam center in Pakistan, it was usually told that it will be open by the end of this year, but hopefully it will be open very, very soon in Lahore, Pakistan. But it hasn't opened yet. And to Dr. Ikra, I wanted to answer you that the course has started from today. Today was orientation session. So try to enroll as soon as possible so that you can get benefit from this course and get yourself prepared. Yes, Dr. Marine, surely try to message us. I have shared my number in the chat box, and we have our team members, Shalim and Sumaya, who are constantly sharing their number. You can just contact them, ask them about any query that you are having. We are always more than welcome to guide you all, okay? We provide free guidance for AMC, so do contact us. If you want free guidance, we are more than welcome to guide you.
Dear Doctor, up till now, AMC2 is still going online. We don't know about what's the further step because they are saying that the new center will be open from the March and it will be from face to face, but it's not confirmed still yet. So yeah.
Dr. Nabila, if you allow, can I share my screen and I can share the website view, like how they can access the regular course?
Okay. Yes. I can stop sharing my screen.
It's okay. Thank you. Okay, so let's have a view of our website. So let's suppose if you have enrolled in the course and how you have to access the course. First, you need to log into your account, enter your username and your password and click on login. After logging into your account, then you have to click on user dashboard. In the user dashboard, you will see all the courses that you have enrolled in, okay? And if you're using the application, then you have to click on My Learning and then you have to click on courses. You will see the course of AMC1 regular course. You have to click on that, and after that, you will see the course dashboard. Now you will be able to see what you will be getting after enrolling in the course, okay? So you will be getting some recalls, you will be getting notes and flashcards, you will be getting topic tests, like everything that you need will be in this dashboard, okay? So let's suppose if you have enrolled in the course and if you want to start your preparation, then what you need to do is you have notes and flashcards, you have to click on that, and then you will find flashcards for every topic that you want to start with, okay? You have ECG flashcard, you have eating disorder, derma, whatever flashcard you want to use, you just have to click on that and then you will be able to see the flashcard. Then if you want to read any notes, then we have provided you notes for every single topic so that you can just read it and make small notes for yourself so that you can just revise it before your big day, okay? So now you will find all the flashcards, notes over here. We have provided you some important files that will contain important images, important tables, just to kickstart your preparation. Then after that, if you want to check any book, let's suppose if you want 100 cases or you want silver book, if you want Australian legal handbook, we will have provided you all the books. You can even download the books from here as well. And then if you want to check the guidelines, we have provided you the guidelines. You can just read the guidelines from here. Then let's suppose if you have read the notes and the flashcards, and if you want to practice questions, then you have to click on topic test. And in the topic test, you will find every topic questions that you can practice. You can see all the topics over here. Then you can see topic wise quizzes. Whenever the topics are covered, like suppose if you are done with surgery module or medicine module, you can just go through the topic wise quizzes and just attempt the questions just to assess your preparation. And then if you want to check the recordings, in the session recording module, you will find all the recordings for the live sessions. So when there will be live session, like I told you before, on the very next day, we're going to provide you the recording. So you will watch the recording over here along with the PDF as well. So let's suppose if you just want to quickly revise all the notes, you can just go through the PDF. But if you want to watch the session, then you can check the recording. Let's go back to the course dashboard. Now, let's suppose if you want to check the recalls, then we have provided this separate module for all the students so that you can check month-wise and day-wise all the important recalls, okay? You can see in the course content, you will see February day 1, February day 2, like you will find 5 days for every month from February till September. And also we are uploading the new recalls as well. We're going to upload the new recalls from October and November as well. So once you join in, you will get all the recordings from here. So now let's go back. And then for the question bank, we have provided you AMC question bank. We have provided you important quizzes, recall quizzes, mock exams, so that you have everything on this dashboard so that you can use to, have your best preparation for AMC. So this was the view, and I have shown you how you have to access the course, where you will find everything, okay?
Any other questions so far you want to ask? Dear Dr. Amir, yes, I just got your question. Don't worry about it. If you lost anything or you lost your subscription after the finishing the course, just contact Asma. She will guide you with details. Don't worry about it. I know you are my current student, and just don't worry about the subscription and the course. If you didn't even access of the website, there will be might be an error or something. Asma can fix it probably.
So to answer Dr. Mahreen, AMC is not that much difficult. Yes, it is a tricky exam, but we cannot say it is a difficult exam, okay? But with right preparation, with best preparation, you can ace your exam. Like I told you, there are the 3 things that you need to focus on: your basic knowledge, your clinical knowledge, your question practice, and the third thing, the recalls. All these important things to crack the AMC exam, we are providing you. So don't worry about this thing that you will be able to clear or not. We are going to make sure this thing that if you follow the course, you will surely clear your exam. Dr. Ria, we haven't suggested you to buy anything. I told you before that we are going to provide you everything. You don't need any other subscription apart from our course. I guess somebody is messaging you with any other thing, but it's not right. We are going to provide you everything, like I told you. So I have shown you the website view as well. We are going to provide you the question bank. We are going to provide you the recalls, like everything that you need, we are going to provide. So you don't need any other subscription apart from our course. Yes, doctor, all our payments are in USD, but do contact us on our customer support numbers. We have shared Charlene's number, Sumaya's number, my number is also there in the chat box. Talk to us, and I'm going to make course affordable for you. We do provide installment options. We do provide friends discount. So if you want to join us in a group of friends, then you can get discount as well. So do talk to us. We are open to discussions, and we can talk about it.
Dear doctor, there are
Yes.
lots of questions from patho and pharma, but they will ask you the clinically. They will not ask you the mechanism of action. They will not ask you the drug's name. They will ask you the clinically. For example, a patient came to you who have a hyperthyroid and she's pregnant and having 3rd week. So which drug you will give? So you have to know about the carbamazole and the difference of other drugs as well. Another thing is that you cannot even go directly to the residency program, because in AMC, whenever you pass your exam from the part 1, you can apply for the jobs. For the job, you will get the job of HMO, GMO, SMO. After getting from the job, you can go for the residency. But for the 1 to 2 year, you have to do the limited registration job for it to go for the residency pathway.
Yes, Dr. Anjali, you can open the application on multiple devices as well. You can use laptop, you can use MacBook, whatever is easier for you, you can use the application on any device. Okay, you can download the application from Play Store or Apple Store. And also we have our free AMC library. So all the students who just want to check the demo sessions, who are not sure whether they should join the course or not, they can just go through the AMC free library. If you want, I can share the link with you all, and then you can just watch over there, or demo sessions or quizzes, and then you can decide whether you should join the course or not.
Yes, we have a recorded session of this. You will get the recording of the session after the session is over. And any other question?
I guess there was a question from Dr. Shaheen. So, Dr. Shaheen, about the preparation time, 4 months are more than enough if you follow the course. Okay, if you do self-study, then it might take you like 8 months, because you have to find out the material and then you have to study as well, and you will be confused whether you are doing right or wrong. But if you join a course, you know what you are doing. So there are mentors to guide you whether about the right path. So if you follow the course, then 4 months are more than enough, and 1 month can be needed to just go through the recalls and for your self revision as well. So 4 to 5 months are more than enough.
Yes, doctor. We help you in getting the jobs. We will tell you the procedure. We will tell you how to make your resume. Just after to the students who will pass the exam and will take course from us, we will guide you in detail about it.
So about the subscription for the regular course will be for 4 months, like I told you before. So if you are appearing for the February exam, so a subscription will be till your exam day. But let's suppose if you are appearing for March exam or April exam, talk to our salesperson. They are going to guide you how you can get the extension. Yes, Dr. Patience, you can just message me and I can provide you the demo sessions. Also, you can check on our website for MedExam Expert. You will find some demo sessions over there in the AMC free library. You will get demo sessions, you will get books, you will get some free quizzes just to kickstart your preparation. Dr. Rabina, about the chances of job, it depends on person to person. There is no specified time period that we can say, okay, after this time period, you will get the job. It depends on your consistency. It depends on your like your CV, your medical interview. There are a lot of factors that depends on this thing, that whether you're going to get the job or not. We know a lot of people who got the job in 2 or 3 months, and we know a lot of people who got the job even after 2 months, 2 years as well. So it depends on person to person. Dr. Nabila, would you like to take some questions? So, Dr. Rabab, to answer your question, so if you want, you can move towards notes and flashcards instead of books, whatever is easier for you. We have provided you everything, and you can use whatever is easier for you, okay? You can even switch to notes and flashcards, and all your topics and all your important topics will be prepared. So, Dr. Ikra, to answer your question regarding a house job is mandatory. So it is not mandatory for AMC exam, okay? But if you want to secure a job in Australia, then house job would add value to your CV, okay? So think like that.
Another question that, as I told you, that basic sciences are not required. The basic sciences will just help you to solve the question if someone have a very good knowledge. But for the study, you don't need the basic sciences because the questions are totally clinical. They will not ask you the mechanism of action. They will not ask you the cell physiology. They will ask you that they will give you the scenario that a person came to you having this disease. What will be the investigation of choice? What will be the drug of the choice? What will be the diagnosis? So these are the questions they will ask you, just like a real clinical scenario. They will just try to just assess your knowledge. Like they will just consider you like a intern in the Australian hospital, and I will ask you the question like that. If someone came with a snake bite, how you will manage this person in ER, how you will manage this person in the GP setting, how investigation you will send, what investigation you will prescribe, what type of diagnosis you will make, what will be the start treatment, what will be the delayed treatment. They will ask you the complications. All the clinical questions will be asked on the AMC 1 exam. So don't worry about the basic sciences. Just start from the clinical preparation, just take the course, just do the John Martag, just do the flashcards, just do the recall, just take the slides and all the guidelines. This is all what you need.
Yes, surely, surely. And also, Dr. Hasi, just to answer you, yes, you will be eligible to apply for the jobs just after clearing your AMC Part 1. You get limited registration to work in Australia. And then after clearing your AMC clinicals or WBA, you will get full registration to work in Australia. And also, if you have any gap, doctor, you have not mentioned your name. So about if you have like 5 months gap, yes, it can affect in getting the job. So what you can do is, in order to fill out that gap, you can mention over there that you have joined for any online course like procedural skill course or ACLS, BLS, any course that you can mention over there in your CV that will really add value in your CV. And about the result,
have a gap. Lots of people have gap in their CVs. You can even do you can fill the gap from the CPT points. You can fill the gap from recency of practice. There are lots of things you will get it after the AMC one. Just don't worry about this thing.
so Dr. Mariam, the AMC 1 result is valid forever. There is no expiration date for that. Dr. Abukun, yeah, you can use AMC 1 preparation for PLAB as well, but the exam format is totally different. You can use it for the basic knowledge and the clinical knowledge, but you cannot use it to clear the exam of PLAB.
Yes, you can even enroll in the residency program even after doing of HMO-ship, JMO, SMO, RMO, whatever the job you will get in the Australia, you have to do it. Like myself as a resident, and it's just like about to end my residency. I'll be the consultant over in Pakistan, but I have to, as I apply from the standard pathway, I have to do HMO, JMO job first, and then I will have join it as a registrar or something. For the first, if you choose the standard pathway, you have to go for the HMO or JMO job as well. Regarding the MLE pathway, you have ECFMG certification, like full steps from step 1, 2, 3. And if you get a whole of this process, then you will have the exemption for AMC. But it's more likely for the PLAB, like those people who have done PLAB 1 and 2 and done their 1 year of internship over there, they can get the GMC and have exemption of AMC as well.
Dr. Rabia, to answer this question, we don't provide free of cost extension because, if you want extension till 6 months or 1 year, it is not justified for all the students who are paid for 4 months only. So if you want details regarding extension, you can just contact our customer support. We are going to guide you about the extension. I guess that's all for today's questions. And if you have still any other question, because it's very, very difficult to answer all the questions in a Zoom session, I guess Dr. Nabila will agree. So in order to, answer these questions, we have shared our WhatsApp number over here so that you can just contact us for complete guidance. We are open to calls. If you want to call and talk to us, we are more than welcome. And if you want free guidance, we can provide you that. Dr. Mariam, we are always available on this number. I have shared my number in the chat box. Just contact me and I will guide you about each and every step.
Also, there was someone who's trying to hacking or doing something. If someone's question will be missed over that thing, so I'm very sorry for that. And if someone get a very creepy reply from that, I'm very sorry for that as well. We just make a session for you guys to just help you out, to just clear your confusions. Thank you very much.
Thank you so much, everyone. Take care of yourself. Bye-bye for today. But we're going to meet very, very soon.